Jasmine Brooks. I'm going to be performing IV administration via Minibag. In term 2, adult health 1, and I'm going to get started. Alright, so first I'm going to check my MAR out, and I see that the doctor has ordered some Rosefrin for my patient. Start her on some antibiotics, so therefore I'm going to look up Rosefrin. I'm going to look at the action, and the action for Rosefrin, or the orders first. So the orders, looks like Rosefrin 1 gram IV daily as directed. We want to check her allergies, since Rosefrin is contradicted in those who have cephalosporins allergies. And then I'm going to look at a little bit more about Rosefrin so I can get some more detail before I administer to my patient. So the action of Rosefrin is it inhibits the third and final stage of the bacterial cell wall synthesis. So basically it's going to kill the bacteria. The purpose is to treat and fight the bacteria. The recommended dosage is IV 1 to 2 grams once daily, and our doctor's order is 1 gram, so it's in the recommended safe zone. Some common side effects is just fever and GI upset, and some adverse effects are going to be pseudomembranous colitis, along with and then contradictions, like I said before, if she's allergic to ceftin, which is a cephalosporin, or penicillin, or if she has previously anaphylactic reactions to antibiotics. Also, I'm going to check her labs because Rosefrin is contradicted in hepatic and renal disease. So I'm going to check the ALT, the AST, the BB, and creatinine, and those are all within normal range. We're going to add the nurse implications, or we're going to administer the IV over 30 minutes. So the infusion time is going to be 17 drops per minute. And how I calculated that is, I'm going to take my 50 ml bag, and I know that it needs to be infused over 30 minutes per doctor's orders, and I'm going to times it by the drop factor, which is on my tubing bag, and that's going to equal out to 17 drops per minute. Alright, so I got the doctor's order, as I said, which is Rosefrin 1 gram IV daily as directed, but what all we have on hand is Rosefrin 500 milligrams per milliliter. Therefore, I have to provide a basic dose of calculation so I'm going to take my Rosefrin, that's the 1,000 milligrams from what the doctor's order, just in milligrams, and then 500 mg is what we have on hand, times 1, which is going to equal my 2 mLs. So I will be adding 2 mLs of Rosefrin to my saline. Okay, so now that we have that established, and we saw that the client has no allergies, I'm going to go ahead and get everything started. I'm going to wash my hands. I'm going to take my Rosefrin. I'm going to draw up 2 milligrams. Just looking at my order again to make sure. Okay, so I'm going to clean off my port, and I'm going to draw up my 2 milligrams. I'm sorry, milliliters is what I'm meaning to say. It is a big difference. Okay, so I draw up my tube of air, and I've cleaned my bottle off. I've checked my expiration date. It's in good standing and it doesn't look tampered with. I'll go ahead and inject my air and my Rosefrin, and I'm going to drop my 2 milliliters. Okay, so now that I have my 2 milliliters, I'm going to go ahead and use the scoop method to let it run. If it stops running for me, there we go. Now keep this on because I am going to add it to my sodium chloride solution. Okay, I'll put that to the side. I'm going to go ahead and add it. So I'm going to clean my port off.
The primary is clamped, and I'm going to clean the port.
Okay, so I'm going to clean my port. Then I'm going to inject my 2 milliliters of Rosefrin, making sure I don't poke myself. Okay. Alright, now that it is injected, I will use the scoop method again to recap. And this will go into the sharps container. I'm going to mix my bag And now that my medication is in my bag, I will have to add a medication label. On medication label, I will be putting the amount that I added, which is 2 ml. Okay, so on my medication bag, I'm going to put the amount that I added, which is 2 ml, to my 50 ml bag, and it was added by me, Jasmine Brooks. The date, which is today's date. I'm going to look at my time and see, put the time, and then the expiration date. Have my patient and the room number. The start time, I am going to wait to label when I get inside the room, just in case there's anything that stops me before I enter the room. Okay? So now that I have that, I'm going to go ahead and draw up my saline. Okay? I'm going to prime my tubing once I get inside the room. I'm going to go ahead and draw up my saline. I'm going to clean up my bottle. I'm going to need 6 ml of saline. I'm going to get 6 ml of air. And on my clean tube, and I check my expiration date. It doesn't look tampered. I'm going to inject 6 ml of air.
This label was on here.
I'm going to go ahead and add my 6 ml of flush.
Time, the dose, the route,
Okay.
and the drug, and the condition.
So now I have my 6 ml.
And I would also document that.
I'm going to put that to the side. Scoop that up. And it's out of this in a shot container as well.
And then,
alright, and when I prime my tubing, I'll be adding my label to my tubing and when to change it. Okay, I'll check my orders again and make sure I have everything I need.
I know what you're saying. Okay, where did I
I got my tubing.
The 4 keys, but I don't think they're gonna really.
Alright, so I got my tubing. My Mara, which is probably going to be on my wow. And I'm going to go inside the patient's room.
Yes.
Hi, I'm Jasmine. I'm going to be your nurse today.
Hi, Jasmine.
Can you identify your name and your date of birth for me?
Mary Anderson, February 12th, 1956.
Okay, Miss Anderson, great. And do you have any allergies that you know of?
No, ma'am.
Okay. And have you had antibiotics before?
Yes, ma'am.
Okay. So the doctor has ordered for you to have Rosetta.
I was like,
So have you ever had an allergic reaction to antibiotics?
It wasn't bad.
Have you ever had any reaction to antibiotics, Miss Anderson?
No, everything is fine.
Okay.
I wasn't sure.
Great. All right. So now that I've verified that she does not have any allergies, which is according to the MAR 2 as well in her records, I'm going to go ahead and wash my hands, which I would have done since I entered the patient's room. Go ahead and put my gloves on. Okay, so I'm going to assess the IV site. I'm going to look for any phlebitis, no, sorry, any redness or tenderness, any swelling, anything that would contradict me not using this IV for the antibiotics. I'm checking the date and making sure everything looks fine, and it does. Therefore, I'm going to check my port, and I'm going to use the ASASH method. So I'm going to unclamp it, and I am going to have to clean my port before I introduce anything to it. So I'm going to clean my port. Alright. Now that it's clean, I'm going to connect my flush, and I'm going to push in 3 ml of solution. Well, first I'm going to aspirate so if I get blood return. Alright, got blood return, so we got a good IV site here, looks like. I'm just going to push, make sure I don't have any resistance, pushing in 3 ml using a push stop method. And I have unclamped my tubing. So before I push in on my mLs, I'm going to make sure the tubing is clamped so I can keep positive pressure in the line. Alright, the tubing is clamped. Alright, so now I'm going to do my medication.
You did. You did good.
Check it against my MAR again, and it is the same. Looking at my label, and thus matches the mark. Okay, I'm going to prime my tubing. And like I said before, it's going to administer at 17 drops per minute, and that's from the 50 mLs that's in my bag. 50 mLs in my bag, and it's going to be administered over 30 minutes, plus the 10 drops is on my setup, which equals to 17 drops per minute. Okay. Alright, so I'm going to attach. Which would normally be at eye level for somebody who's not height challenged like me. Okay, making sure my tubing is clamped before I let it run, and everything is clamped. Then I'm going to bring it down. Okay. There it is. It's all clamped. Okay. So I'm going to let it hang, and I'm going to go ahead and unclamp it. Alright. We're going to unclamp here. I'm going to slowly unclamp. And it should run, making sure we get all the air bubbles out. Okay. Alright. So now that the tubing is primed, I am going to insert it on my patient. So I will use a fresh alcohol wipe and clean the port again. Okay. Unscrew. And connect my IV. Alright, so now I'm going to calculate my 17 drops per minute. Using half. And let it run, checking my drops. Okay. Alright, so it has been a minute, and it is administering at 17 drops per minute, and it is set. I'm going to assess my patient. This is not her first time receiving antibiotics, but I will still stay with my patient to make sure she doesn't have any adverse reactions. That usually happens within the first 15 minutes of administering antibiotics. I am going to record, of course, I have labeled my tubing. I've labeled my tubing with my label, which is going to have the date, and the time. And then I'm going to actually record how the patient reacted to everything. What I did infuse, look at my MAR and record on my MAR everything. And I'm going to take off my gloves and perform hand hygiene. And then I will come back and assess the site and make sure it is fine and there's no redness or swelling or any kind of other reaction. So after this administration, I will be back in about 30 minutes. Okay, thank you.